connect. I would first like to really thank Professor Kostis for opportunity to be here, and I think this is very important. Today I will present also not just this presentation on behalf of ISPH, but also I'm very proud that I thank also that HISPA is one of the participants of this Congress, and I hope maybe next year we will do some joint session between the Vasilius and the HISPA association as well. Actually, I this is my favorite subject because in ISVH we always said vascular health, this and age. So I really like this aging part, and I would like to share with you several thoughts and scientific achievements related to aging, which definitely maybe is underrated and with not much attention. Unfortunately, in previous presentation, we saw that we're not doing a great job, especially as Arman said, in the eastern part of the Europe. Not that we are in very high risk also, but unfortunately, this prevention, from my point of view, also should be different or better. But I would like to focus your attention on one of the first editions of Harrison's Principles of Internal Medicine with famous Brownwald and other authors. And Eugene Brownwald, together with Karl Engelman, he wrote in chapter 37, this statement was 40, 50 years ago. Systolic hypertension in the presence of a normal or reduced diastolic pressure is rarely considered to be responsible for organ damage, but usually reflects other pathological processes. This is, I just want to state that hypertension was in some time not considered so dangerous as now we know it is. And then we learned a lot about arterial stiffness. And then we started to ask ourselves some questions like, which comes first, chicken or egg? Which is this, does actually, do we have a hypertension and then followed by arterial stiffness as a consequence, or vice versa? So up to date, for the last decades, this concept between aging, arterial stiffness, and hypertension is developed, and this is the reason I put the name of this presentation, Two Riders of the Apocalypse, since it's definitely true. And 8 years ago, Nabil Alama actually reviewed some things related to aging influence on the cardiovascular system, and I will summarize this in this beautiful Greek publication for 7 years ago, Aging and Cardiovascular System, when we show two things. First, that aging is doing something to the heart progressively, mostly with the concentric hypertrophy of the left ventricle, changes like calcification of mitral annulus, some conduction abnormalities, diastolic dysfunction. We all know that. On the other hand, aging is definitely doing something to arterial tree as well. So we have arterial stiffening and arterial dysfunction, and of course, continuous process of arteriosclerosis. As a consequence of this knowledge, now we have a revised cardiovascular continuum. Why revised? Because besides the traditional risk factors we have been talking about in this session, like hypertension, dyslipidemia, diabetes, smoking, now we know that aging is an independent risk factor, which are, as I said, leading to, on the other hand, endothelial dysfunction, atherosclerosis, stiffening, and hypertension, especially isolated systolic hypertension, so often seen in elderly people, which consequently leads to other forms of clinical forms and pathological forms of arteriosclerosis, like microvascular disease, thrombosis, hemorrhage. And actually, at the end, it all went to the ventricular enlargement, heart failure, remodeling, arrhythmias, and end-stage heart. And what is the markers of aged cardiovascular risk patient? I said that the cornerstone is definitely arterial stiffening, which leads to elevated systolic and pulse pressure, lead to elevated pulse wave velocity as a part of arterial stiffening. As a consequence, we have a higher aortic impedance and LV afterload. As you can see, in the end, we have mostly impaired diastolic function with sometimes preserved the systolic function. And Pribe, in the same article 25 years ago, showed that there is a difference in increased flow demand in young patients and advanced age patients. Why? Because advanced age patients, they have a blunted beta adrenoreceptor responsiveness, which leads, you can see, to all other pathophysiological mechanisms, which consequently leads to the higher susceptibility to cardiac failure. Of course, this small group over here contribute also to the aging by showing very nicely of effect of metabolic syndrome on arterial function in different age groups. And we, of course, very clearly presented, Gerard and co-authors presented how the aging definitely together with metabolic syndrome contribute to the arterial stiffness. Also, two riders of the apocalypse have a special pathological aspect of vascular fibrosis, and these mechanisms are clearly seen in all layers of blood vessel, including intima, endothelium, vascular media, and adventitia. So you can see there's a lot of pathological changes which leads to the vascular fibrosis. But as I said, to riders of the apocalypse, you have in the same time influence of aging and pro-hypertensive factors like renin-angiotensin system, endothelin 1, aldosterone, which, as you can see, changes a lot of things on